As our former president, Dr. Anthony Parker, would say, it's a great day to be a Titan. Today we want to refresh our practical nursing program. Several months ago we started this campaign about refreshing some of the traditional programs that we've had here on campus for years. So we want to make sure that the community was aware that these programs are still vital to the community, and practical nursing is one of those particular programs. As we know, with the pandemic in 2020 that came upon us in the United States across this world, we realized how vital and important our nursing industry is. And so the practical nursing program here at Albany Technical College has done a tremendous job in producing nurses for the industry. So we want to thank our faculty and also our students and administration here in the practical nursing program for doing such a wonderful job and teaching future nurses for the industry. So again, thank you and welcome to Albany Technical College, and we look forward to you coming to fall semester with us starting on August the 17th. So again, thank you and welcome.
Thank you, Dr. GRISWOLD. Dr. GRISWOLD is our interim president, and I am Lisa Stevens, the Dean of the Business and Healthcare Technology Division here at Albany Technical College. So we'll continue through this refresh event, and what the purpose is of today is to refresh our existing programs that we have. Our practical nursing program has been on this campus for many, many years, have produced many graduates who are now employees in our service area. Our graduates have gone on to work in long-term care settings as well as hospital settings, and also in private practice and physicians' offices and outpatient settings as well. Our nursing program, specifically our practical nursing program, is a program that will allow you an opportunity to have a faster entry into your nursing career. Some other highlights include there's solid earning potential in this profession as well, with strong projections for job growth. And lastly, we have very few barriers to entry into the program. And so without further ado, I'm going to bring up the program chairperson, Ms. TERESA DARITY, to talk about the actual program.
Hello, I'm here to let you know a little bit about practical nursing, and first I want to go ahead and introduce the team that I have with me. We have Ms. Casey Everson. She teaches our leadership along with me, also pharmacology as well as maternity nursing. Ms. Annette Smith, she teaches fundamentals as well as medical surgical nursing. And Ms. Clarissa Smith, she teaches our medical surgical nursing across the board in this program. Our program is a diploma program that consists of 4 semesters. Those 4 semesters beginning with the first semester being core, and the last 3 semesters would be solely for our practical nursing program courses in clinical and didactics. We have moved from a 4-semester to a 3-semester program to allow for our courses for practical nursing for us to finish a whole lot quicker and people to get out into the workforce a whole lot quicker as well. Our program has just received ACEN accreditation, which is a national accreditation for nursing and education. We are one of 7 out of 22 in TCSG who has now acquired this achievement, which means we are now being said to have the highest quality in our practical nursing area in TCSG. Our program also has been slated to have places in some of our externships so that students are now being exposed to nursing earlier, as well as having access to hospitals as we transition into team nursing. Throughout our program, our students have access to 6 clinical sites so that they have access to multiple areas, hospitals, nursing homes, multidiscipline areas, as well as dialysis and other forms of nursing. Throughout our program, our students have different opportunities to participate in hands-on skills as well as simulation areas so that they're familiar with the transitions in nursing and how we transition and how we participate on the different levels of nursing.
Hi, my name is Monica QUIROZ. I am an LPN who graduated in the May 2021. And I went through this program, and the staff here, they really instructed me to get ready for real life. They have a very nurturing atmosphere here where it's a safe environment to learn. And in doing so, it allowed me, once I entered the real life, that during an emergency, I was able to react with the knowledge they have given me and act swiftly in order to save many lives.
Hello, my name is WAKEELAH McIntyre, and as she stated, I am a current student. One thing that I love about this program was with me, I made a big transition from education to the medical field. So starting in fundamentals, it was kind of tough for me at first just to kind of switch from that teacher mind of thinking to a nurse. I had Miss Annette Holloway who taught fundamentals. She just kind of gave me some pointers and some extra study tips and really just helped me enhance my critical thinking. And now just moving into med surg, I can say with all my teachers that I had, including Miss DARITY, they always have an open door policy. If you have any questions, need to switch your study or just thinking methods, they're always there to give us pointers, just to kind of get prepared for the real world. Even at Phoebe and clinicals, they're always there. If you got a question, they're there for it. Even with skills, I've gotten the opportunity to change an NG tube dressing, finger sticks, of course blood pressure, and even give like insulin shots. So even with my skills and going into the hospital doing that, it would have been possible if they weren't there for me every step of the way in the lab and just doing simulations, giving me those pointers and directions. So this program is most definitely very nurturing, a great program overall, and so far so great. I'm doing well. My critical thinking skills have enhanced, and that's all due to the staff that is here. So yeah, most definitely, if you're looking to come into the nursing field, I would say come to Albany Tech and starting the LPN program is a very great program.
Hey, good morning. Again, I'm Clint. I'm representing the Hospital Authority of Miller County, Miller Nursing Home. I want to first start by stating that I started my career as an LPN, so I'm very thankful for the opportunities it provided for me and the education I garnered within the program. So again, I'm with Miller Nursing Home. Excuse me. We are a 100-bed vent facility. We have a census of 156 beds, but again, 100 vent capability. Vent and trach is what we mainly serve. We're made up of 3 units at our nursing home. One of our units is vent, trach, as well as dialysis, which we contract out through another company. Another unit is mainly just vent and trach, and then another unit is the traditional, I guess we call a nursing walkie-talkie, or traditional what you would find in a nursing home, rolling around in wheelchairs and stuff like that. So on each unit we have carts. So each cart, that's where an LPN would be employed at. On your cart, you have a census of around 10 residents. You have a CNA on your team, an LPN. You have an RN supervisor that you can go to for guidance and support, as well as a respiratory therapist there for support as well. And by doing the carts, that provides us more individualized and personalized care so that you can spend more time with your resident, and you keep that same cart. You're not on a different cart every time you come to work, so you become familiar with your residents and they've come to know you as their nurse. So as an LPN, you do a lot of skills. We allow you to do everything except, of course, hang blood, and we do not allow any medication push. But we do have Foley catheters, suprapubic catheters, PICC lines, midline, central lines, of course, working with dialysis with the perm cast. So a lot of skills learned, a lot of fluids, sometimes they're on antibiotics. So you have an opportunity to learn a lot with us. On each unit, too, I want to add, we have our wound care team, social worker, we have a clinical care coordinator that just oversees the daily clinical activities of the unit, infection control, of course, the RN supervisor, and we have a director for each unit as well. So a lot of support to go to, as your time, if you're with us. I want to add too, we have mid-level providers 24/7 that are there in-house. So anything going on with your resident, any questions, they're right there to provide help for you. Each unit also has activities, to keep the residents as active as they can, depending on their mobility. Also, we have physical therapy and occupational therapy if they're a candidate for that. And by you keeping those same 10 residents, it just provides you consistency day after day as you provide your patient care. And by coming to join us and working with us at Miller Nursing Home, we hope you will be able to gain experience and stay with us and be more prepared as you continue your education. So thank you. Appreciate the time. Thank you for the opportunity.
Good morning. My name is Rick FALLAW. I'm the administrator at Pruitt Health Palmyra. When I first came to Albany back in 2021, this was one of the first calls I made. Given our situation and our staffing challenges that we have in our industry today, I felt it very important to develop a relationship, and I had heard many great things about Albany Tech, and so I reached out to Miss Casey and Miss TERESA and developed a relationship with them. And I'd like to say today we probably employ about 4 or 5 of Albany Tech graduates.
4 or 5 current.
Current of the newer students.
But
And
we have quite a few seasoned nurses that came from Albany
Yep.
Tech.
And I have Michelle Rivers here. She is a 2002 graduate of Albany Tech, and so we're very proud of her, and she can speak to her experience. But I would like to say that these students, when they come out of Albany Tech, are the best prepared new nurses that I have ever seen. And it is a testament to the leadership, to the faculty, and we are just blessed and honored to be a partner with them. We enjoy coming out and visiting with each class towards graduation to let them know what we offer at Pruitt Health and being in the long-term care sector. So we are honored and appreciative to have Albany Tech in this community and look forward to working with them for many more years.
So my name is Michelle Rivers, and as he said, I am a 2002 graduate from the practical nursing program here at Albany Tech. So everything that he said about Albany Tech producing good nurses, I know for a fact is true. We have many seasoned nurses, some that I went to school with, some graduated prior to me, and some shortly after. We have 4 recently graduated practical nursing students that are, well, graduates now that are with us. Great nurses, strong nurses. When I started, my first job out of nursing school was at the time Palmyra Nursing Home, and now it's Pruitt Health Palmyra. And we were a nursing home. Now we're a skilled nursing facility. So we do most things that the hospital does within reason, so we're able to care for the residents in the facility without having to send them out because we are able to start IVs, draw blood, whatever the skills are that we've learned here at Albany Tech. So we have plenty of job opportunities from charge nursing on up. We've got wound care positions available, infection preventionists. There's many positions available as a practical nurse, and even if they go further and become registered nurses. But Albany Tech definitely is a great opportunity, and here locally there's plenty of jobs. But we would like you to come to Pruitt.
Thank you.
Thank you.
Okay, I do want to answer the question of licensing. Once they are done with our program, they would sit for the NCLEX PN for the state of Georgia, and they can also apply for a compact license that would allow them to operate in 35 other states. Our program accepts students in the fall and spring. For fall admission, the application deadline would be June 30th, and for spring admission, the application deadline is October 31st. Our students can find the applications on our website, and if you need to get in contact with any one of us, you can use the information that will be provided on the screen to contact myself or any of the other instructors, as well as Ms. Beverly Grimsley, our administrative assistant, at bgrimsley@albanytech.edu. Thank you.
So this concludes our refresh event, and we look forward to seeing you.